Most women think that a misty period is the very first sign of pregnancy. What if I told that your body actually starts sending little signals way before that? Hi, I'm Dr. Lucy, a medical doctor, and this is Know Your Health with Dr. Lucy, a space where we share everything related to your health. So if you're interested in such kind of content, do well to hit the subscribe button and turn on the notification bell so that you do not miss any new upload. In today's video, I'm going to share the earliest signs of pregnancy you can notice before your missed period, and some of them might surprise you. One of the very first signs some women notice is implantation bleeding. This happens when the fertilized egg travels down to the uterus and attaches itself to the uterine wall. During this process, a little bit of the lining of the uterus can shed, and this causes light bleeding or spotting. It usually happens 6 to 12 days after ovulation, which is actually before your period. Unlike a normal period, implantation bleeding is usually much lighter. It can look like pink or brown spotting and doesn't last long, maybe a few hours or a couple of days. So if you notice light spotting earlier than your period and it's not heavy like your normal flow, it could actually be an early sign of pregnancy and not your period starting, so do not confuse that two. Implantation cramps. Many women expect cramps only when their period is coming. But what most don't know is that you can actually feel mild cramps before your missed period, and this could be a sign of early pregnancy. Here is what happens. After fertilization, the egg travels down the fallopian tube into the uterus. When it finally attaches itself into the uterine wall, your body may respond with some light cramping. These cramps are usually mild, short-lived and not as intense as that of menstrual cramps. Some women describe them as pulling, tingling or pricking sensation in their lower belly. They often happen around the same time you expect your periods, which is why many women confuse it with premenstrual symptoms. The key difference is that implantation cramps do not last long, and they are not accompanied by heavy flow or intense pain, which usually comes with the period. So if you feel unusual gentle cramps after ovulation, it may just be your body's way of whispering that pregnancy has begun. Breast changes. Pregnancy hormones, especially estrogen and progesterone, increase right after conception. This causes your breast to feel tender, swollen or a bit sore, almost like before your period. You may also notice your nipples and the areolas becoming darker, or the veins on your breast looking more visible. Some women also feel a tingling or heavy feeling in their breasts. These changes are your body's way of preparing for breastfeeding, and they can start very early within 1 week or 2 after conception. Fatigue. Many women suddenly feel unusually tired, even if they haven't done much that day. This happens because right after conception, your body starts producing high levels of progesterone hormone. While this hormone is very important for maintaining pregnancy, it also has a calming effect on your body, which can make you feel extra sleepy. At the same time, your body is also working hard to support the tiny new life growing inside you, which uses up more of your energy. That's why you find yourself getting tired much faster than usual. So if you notice sudden tiredness that is out of ordinary for you, it could be one of the first signs that you're pregnant. Increased urination. You may notice yourself going to the bathroom more often than usual. So why does this happen? It's actually due to hormonal changes. Right after implantation, your body increases blood supply to the pelvic area, and this makes the kidneys more active. This means they filter more fluids, which end up filling your bladder faster. As a result, you find yourself waking up at night to pee, or making more frequent trips during the day. This frequent urination can begin as early as a week or 2 after conception, and it often continues throughout pregnancy. Nausea, or what we normally call morning sickness. What's interesting is that it doesn't wait until after you miss your period. For some women, nausea and food sensitivity can begin very early, even within a week after conception. This happens because of the rapid rise in pregnancy hormones, especially HCG. These changes can make your stomach more sensitive, leaving you feeling nauseous. And it's not just in the morning, it can happen any time of the day. Along with nausea, you might also notice sudden changes in how you react to foods. So if you find yourself avoiding your favorite food because it suddenly makes you feel sick, foods you normally love may suddenly turn your stomach, while some foods or smells may seem unusually strong or unpleasant. Some women even develop cravings for unusual things, or you are unusually sensitive to smells around you. It could be an early sign of pregnancy. Mood swings. One moment you feel happy and the next you might feel irritated or even tearful over the smallest things. This happens because of the sudden increase in hormones like estrogen and progesterone right after conception. These hormones affect the brain chemicals that control your emotions, making you more sensitive than usual. So if you find yourself reacting more strongly than normal, crying easily or getting upset without a clear reason, it could be your body's early way of telling you that you're pregnant. So as you can see, your body can start giving you little hints of pregnancy even before you miss your period. Of course, sometimes these signs can be mistaken for premenstrual symptoms or other normal body changes. So the best way to know for sure that you're pregnant is to take a pregnancy test. And it's also important to remember that every woman's body is different. Not all the signs will show up for everyone, and they don't usually happen at once. So if you don't experience all the symptoms, it doesn't mean you're not pregnant. It just means your body is responding in its own unique way. With all that being said, if you found this video useful, don't forget to give a thumbs up, share it with a friend who might find it useful, and subscribe for more health tips every week. Let's meet again in our next video.